today's video, I'm going to talk about some of the patients that I saw today and some of the lessons learned. And I think by the patients that are going to be described, there's some general principles that are good to follow. One is be kind to others. 2, don't judge others. 3, find comfort and solace in the right places and healthy places, not through bars or gangs. 4, find your faith and know your faith. 5, say no to drugs. And 6, be supportive to your family and friends. First of all, the reason I say be kind to others is because if you're not kind to others, if you're aggressive, if you have dark thoughts, if you have ill intentions, over time those things can affect your mind, your body, your soul. So the first patient I saw has a history of schizophrenia, was paranoid, not able to cooperate with the interview. And the reason I went to see them is because overnight something happened in the hospital, they're agitated, and they needed an intramuscular injection. Now, I'm not saying that all people with schizophrenia have those ill intentions or vice versa, although there is likely an association based on many people with schizophrenia do have a suspiciousness or paranoia of other people. That can also correlate with the second principle, is don't judge others, because we don't know exactly the reason for all mental illnesses. You could look at one of my previous videos about what I hypothesize is the reason for almost all mental illnesses. But in this case, there may be a family history, there may be some sort of dynamics. The next patient came to the hospital because they were confused. They did some of the blood check. They found out that the electrolytes were off, and they had a history of bipolar. And when meeting with this person, they informed me that they were part of a gang and there was some violence involved in parts of their life. And also we got information from family that there's a history of drug use and a mood disorder. A lot of times people may get into gangs because they find comfort or camaraderie with other people, but it really can lead to drugs and violence and a lot of negative consequences that can affect your mental health, whether it's mood disorder, anger, post-traumatic stress disorder. So another patient was admitted because they had a suicide attempt, and then even while in the hospital they had multiple suicide attempts, and now a few weeks later they're feeling better, not suicidal, and they want to go home. And so they're asking me to see, is this a safe plan? From a psychiatric perspective, there's a few things which are really important to assess for suicidality. 1, are they currently suicidal? Are they depressed? Taking their medications? Any history of drug use? Also religion and spirituality. Those things are incredibly important because religion and spirituality oftentimes can be protective. It may be against the religion to commit suicide. So another principle is know your faith well and find your faith. Okay, the next principle is say no to drugs. I have a male who was admitted to the hospital for some sort of medical condition, but over the hospital he developed confusion. There's no family or friends that are in contact with him. Essentially burned his bridges, and he might have to be conserved with the state because someone has to help make the decisions. A patient with schizophrenia who was in restraints because when the staff attempted to clean him earlier in the morning, the patient hit the nursing staff, and so they had to restrain him to ensure safety. Another patient was admitted to an intensive care unit because they had shortness of breath due to heart failure, and the heart failure was likely caused by illegal drug use. And the patient, when I saw them, they weren't in the intensive care unit, they're on the medical floor, but they were very agitated, yelling, couldn't really be calmed down, and they needed stat IM medications in order to calm down and ensure the safety of themselves and the unit in the hospital setting. Another patient who I saw was in the intensive care unit after an overdose on medications, grew up with an abusive parents, homeless, and was just going through a depressive time and really trying to really wanting to end their life at that time. Next was an elderly lady who was confused and hallucinating due to a urinary tract infection. Another elderly lady who was confused initially, now as her medical condition is more stable, doing better, wants to go home, but after talking with some of her family, she was actually very paranoid, wandering, and seems to have a dementia picture, so we have to coordinate with the family to see what is the best, where the best place is to have her, since she's unlikely to be able to care for herself at home.